Hello, everyone. You're listening and watching the smartsocial.com podcast. I'm your host, Josh Oakes. Today, we have an exciting topic. It's an unfortunate topic, but it's a topic nonetheless that is something we need to talk about at a younger and younger age. Your students are seeing people online that look great. They're on Instagram and people are living their very best life. They're showing themselves on vacation. They're showing themselves doing great things, and they're showing themselves looking their very best. Today, we have an absolute expert here today that's going to talk about what your students see online and what your students are looking at day in and day out as they scroll might not be real life. I have today with me a very exciting board-certified plastic surgeon live from Beverly Hills, California, Dr. Radi Rahban. Welcome to the podcast.
Good morning, and thank you for having me. I think this is a really important topic, so good for you for championing it.
Well, thank you, doctor. So you are a board-certified plastic surgeon. You have your own solo practice. You've been doing this for 15 years. You are a Los Angeles bred. You went to Beverly Hills High School, UCLA, USC, and you do all kinds of things that are cosmetic. You were on Access Hollywood in the last couple weeks with Mario Lopez, and this is a hot topic. So we're thankful that you're here. And as we reach millions of people on our podcast, our website, and our YouTube channel, teaching them how to keep their kids safe on social media so they can someday shine online and get that dream job, there's a lot in between. And so I want to dive on in with you, doctor, real quick and ask you. Now, first of all, give us just a real quick of what your practice does for people. And then I want to talk about why people are coming in younger and younger. So what do you guys do?
All right, wonderful. Well, thanks for having me. I'm a plastic surgeon, so let me give you a little bit of insight as far as the alphabet soup of practitioners, because this is part of the reason why people are getting in trouble. So number one thing you need to realize is the word cosmetic surgeon has no meaning. There is no cosmetic surgery training. In that, you are trained by doing different specialties. So for example, you're an orthopedist, you're an ENT, you're an OBGYN, you're an ophthalmologist. You then can go on to doing cosmetic surgery in those arenas. Plastic surgery is its own training. You are a plastic surgeon and then you become board certified. When you go online or anywhere else to have surgery or procedures, fillers and Botox done, often you are misled or confused or do not understand the qualifications and training of the individual you have selected. By that, I mean you assume that if they have a white coat, a pretty practice, and a nice web presence, that they're trained to do it. So being smart about it is understanding ground zero, who is the individual that you've selected. So plastic surgeons, you have ENTs that are called facial plastics, you have ophthalmologists who are called oculoplastics, and then you have a whole world of cosmetic surgeons. Those would be your OBGYN who's tired of delivering babies is now doing tummy tucks. Mm-hmm. Your general surgeon is now doing breast augmentation. So you just have to be very careful and deep dive and figure out what their training is. So I'm a plastic surgeon. My practice is made up of the entire spectrum of aesthetic surgery. That would be rhinoplasties, your nose jobs, and mommy makeovers or facelifts and eyelids. And I love what I do. I've been doing it for 15 years. I cannot tell you the number of transformative experiences that I've been a part of in their journey. I think it's an amazing tool in that it can help propel someone into another category of happiness. So there's a lot of naysayers and anti-cosmetic surgery individuals, which I respect in their perspective. But when an individual is the right candidate, and I'll explain later if you ask me what that is, they can do incredibly well from cosmetic surgery. So that's what I do.
Fantastic. So the reason we're having you on here is because parents are coming with their students at a younger and younger age, and they're asking you, how can we adjust our students' nose? Can we do all this other stuff to let our students look more like this influencer? Maybe our students can get more followers, more this, more that. Can you speak to us? What are people saying to you more and more? And talk to us about that.
So what's happened is let me give you an insight. So what's happened is from the beginning of time, Cleopatra, whatnot, aesthetic icons have existed. The concept of beauty is embedded in all mammals, right? The bird with the prettiest feathers is the one that's going to mate. The lion that's strongest will mate. So this idea that we want to look our best is not a superficial social experiment of today's time. That's ridiculous. What's changed is our sense of beauty. Before we liked being fuller, then we liked being skinny. Now we're thinking of curvy, etc. What's happened is the images that we're getting, or the social or the beauty icons, have expanded 1 millionfold. Before it was like, I don't know, Sophia Loren and a handful of people. Now everyone sees themselves as a beauty icon, and they're online and they're now putting themselves out there. The problem was, before, these people that we were trying to strive to be like, right or wrong, were more attainable. What does that mean? That means that if they had a certain look, it was a real look. And so what's happened now is younger individuals who are impressionable, because we know when you're 13 or 14 or 15, you can get into drugs, you can get into promiscuity, you can get into a lot of things because your brain is very soft and can move in directions. They're getting all these images, and it's starting to tweak the way they see themselves and what they want to look like. And the problem is that the images that they're seeing are not attainable. It's impossible for your skin to look like a filter. Mm-hmm. It's impossible for your eyes to be super large. It's impossible for your waist to be this big while your breasts are that big. And these are all things that are done through manipulation of either using apps or angles. And so as a result, the biggest issue is what people are requesting or wanting to look like is not possible. And hence the disease has begun. That takes care of issue number one. Issue number two is it's not so much that parents are bringing their children in. It's more so the following. Either young people are coming in on their own to doctors saying, hey, you know, I don't really like my nose, or hey, I'm thinking my eyebrows need to be higher like Bella Hadid, or have you seen, and there's so many influencers like, what's her name, Bieber, I don't even know their names, but there's so many of them. And young people are coming in on their own, asking to look like this, or their parents are sort of hostage, and they realize that if they don't participate with their children, because imagine this, your child is unhappy. So as a parent, you want them to be happy. That's your goal. And you educate them that they're beautiful and they're perfect, but they're still unhappy. So you have two options. One is to ignore it and let them go do whatever they're going to do, or two is at least participate and help guide them through the process. Mm-hmm. So it's not so much that parents are coming in at 13 and saying, hey, my daughter will look prettier with a better nose. It's more like a young girl comes at 16 and is very unhappy and socially awkward, and her parents are like, we don't know what to do. Could we have a dialogue?
Interesting. Very interesting. So what would you tell parents? So they're coming in, students are coming in on their own, parents are bringing and having a dialogue. What do you tell people? What's one of the tips so that they can understand the differences that you talked about? It's not possible to make your eyes bigger, your waist smaller, and all these different things.
So, I mean, listen, it's a dialogue you have about self-esteem. So plastic surgery is a fine line, right? On this side of it is a very solid, grounded individual who is doing great in life, but truly doesn't like their ginormous ears that are pinning out of their side of their head. And that's totally normal. That's acceptable. And they would do so well if their ears were just rotated back a little bit and had an otoplasty. On this side is an individual who thinks their nose is ginormous, doesn't get eye contact, is super unhappy about the way they look, is trying to lose weight even though they're thin. And that's an unhealthy sense of self or perception. So the first thing is to see how healthy are you within. If you're a grounded individual and you come in and let's say you came in, you said, listen, hey, you know what, doc? I love myself. I'm happy. My wife and I are happy. But you know what? I don't really love my nose. I've not liked it since I was a young boy. That's totally acceptable, right? But when I see a young person or even an older person who comes in and you could tell by the dialogue that they're just overall unhappy in life about many other things, plastic surgery is not the Band-Aid. So that's number one concern, is you got to have a real deep dive in terms of self-reflection. Whether you do it on your own or in the instance of your listeners, you got to help your child. If they're saying my nose is huge, and let's be honest, their nose is not huge, or then you need to say, okay, honey, no problem. We can have this dialogue, but maybe we should talk to somebody about, like, you need to dig. That's number one. The second thing is you have to look at the images that they bring in. You know, I don't allow images in my practice. In other words, you can't bring me an image of someone and say, hey, I like this, whatever. I just don't allow it. Why? Because it's already a path of no return, right? Because you literally are saying, I want to look X or Y. You want to look your best version, right? You want to look improved. You want to look enhanced. You want to look
that, doctor.
You want to look
your best version.
You want to look cleaner than your. So we say balance, we say and better harmony, we say a better version of yourself. You can't bring me a picture of Bella Hadid's nose and say I want to look like this. That's insane. That's not even realistic.
Yeah.
And I think the last thing is when we look at the images, you thank God for this is how everything works in life. There's a pendulum. So what's happened is that people like you, like me, we call us the whistleblowers, are now starting to bring light to the unrealistic nature of all of these celebrity and influencers' images. Mm-hmm. So there are many, many sites where they are juxtaposing, let's say, Kim Kardashian's photoshopped images of her butt in contrast to her on the beach in the Maldives and shot by a paparazzi. Her butt is not smooth, it's full of cellulite, and it doesn't look as nice as she says. And so what people are doing, which is a wonderful thing, is they're holding these people accountable and showing their images, saying, hey guys, this isn't real. This is not what so-and-so looks like. And when I think more of those images comes out, it's almost like people have taken a drug and then you come out, you take an antidote and you're like, oh my God, wait. Oh yeah, wow, they don't look like that. So I have no problem with wanting to look like your best version. I have no problem that if you're overweight, you want to be thinner. It's good for you. I have no problem if you're losing your hair, you want to get a hair transplant. I'm pro aesthetic enhancement. I'm just not pro feeling bad about yourself because you look like a fake image. You don't look like a fake image.
Mm-hmm, mm-hmm. This is really powerful. Doctor, I like what you said. How healthy are you within? Let's dig and let's better understand that. Has to start here. Couldn't agree more with you. Look your best version. And then that's great. Hey, doctor, tell us a little bit more. We're going to link below to your podcast and to your website. Tell us the name of your podcast. It's called Plastic Surgery Uncensored. Is that correct?
Right. Plastic Surgery Uncensored. So much like you, who is trying to champion the idea of awareness. That's what this comes down to. It's called transparency and awareness. If you know that you're going to X, Y, and Z place, and this is their training, I'm high-fiving you. But when you don't know, and you don't know what you're getting into, I feel terrible for you. And as a person who considers themselves a leader in my field, about a year or more ago, I decided I'm tired of seeing, a third of my practice is revisional. That means I'm seeing people that have had bad outcomes. So I created the podcast in an effort to do what you do, which is to educate people on how to navigate the most extraordinary and potentially dangerous world of aesthetic, cosmetic surgeries and procedures. So Plastic Surgery Uncensored is a very raw and sort of unbashful approach to what you need to know when it comes to A to Z of cosmetic and plastic surgery. And we've had a lot of people who have said that it's changed their perspective and led them down the right path. Again, the goal is, like, as I said to you before, I don't want to be an alarmist. Plastic surgery is awesome. It's just awesome when it's done correctly.
Mm-hmm. Doctor, I'm so thankful that you're here. Those of you listening and watching, please take the next step to click some of the links below. Remember to talk to your kids about being safe online. We believe that safety really starts before you give them a phone. A phone is a lot like a car, and giving them social media is a lot like a car. You, A, need to always have keys to that car, a passcode, and B, talk to them about driving safely on that digital car way before they get it, not when they get it. So please, and that could start as early as 2nd and 3rd grade. Mental health is right on its heels right there, talking about how to be a good friend online, happiness. And then instead of just telling your kids what not to do, consider Googling them and showing them how their online image changes.
Yes.
Build in some wisdom. And what we're teaching, Doctor, on our side is how to shine online, giving kids a purpose instead of just a pastime. soon as we hand this to them and give them the driver. Let's show them where to go, not just here's free reign to connect with 7 billion people on the internet. Doctor, I really appreciate your time because I know you've got patients. You've got all these people you got to meet with. So thank you to you. Thank you to everybody who's listening and watching. Please rate, subscribe, and review so that we can share this with more parents. We'll see you all very soon. As the title of my book says, keep it light, bright, and polite because your kids are watching how you behave online. We'll see all of you on the next episode. Thank you, Doctor. We'll see you guys soon.
My pleasure. Thanks for having me.
Have a great day.